Welcome to Nevada NewsMakers. On the program today, the topic, the State of the State address and Governor Sandoval's appearance on this program. On our last broadcast, we discuss all these things. Larry Mathias, Chris Wicker, and Mike Bosma. It's all coming up next on an all-new Nevada NewsMakers.
Nevada NewsMakers is brought to you in part by the Tahoe Reno Industrial Center, the world's largest industrial park. The resort at Red Hawk. The Whittemore Peterson Institute, where today's discoveries are tomorrow's cure. And the Las Vegas Review-Journal and ReviewJournal.com. This is Nevada NewsMakers with host Sam Shad, a no-holds-barred political forum. Now, from the Nevada NewsMakers broadcast headquarters, here is Sam Shad.
And back on Nevada NewsMakers, we have a great Power Pundit panel, and we're going to be with these guys for the whole show. Lots to discuss today. Mike Bosma is here, the president of the Bosma Group. Larry Mathias is executive director of the Nevada State Medical Association. And Chris Wicker is spokesperson for the Washoe Democratic Party. We want to talk about the governor's State of the State speech and your initial thoughts on that.
You know, I thought it was his best political speech, and it was after he got elected. I thought he was very sensitive to both sides of the aisle. I think he articulated his plan well. It was amazing how much, really, how much he was able to deliver in a very short amount of time being in office. And probably more importantly, I think he really about building consensus and having a plan that will work. So I think now...
Consensus with whom?
Well, I would say by the Democrats. You know, obviously not consensus, just reading some of the responses coming out of that. But I'll tell you what, they weren't nearly as negative as the prior governor's budget proposal. So, you know,
is that a comparison you really want to make, Larry?
Probably not. No, I think it was a very interesting and well presented set of parameters for where he's trying to define how the legislative session should go. It was optimistic. At the same time, it was realistic. He presented it in a very likable way. I think that's because he's a very likable person, and I think showed a mastery, or he and his team, a mastery in a fairly fast way of some very difficult issues. I think that it was restrained, might be the appropriate term for it, but it did set at least his starting point for the legislative session, and I think it drew very interesting and restrained responses from the leadership in the legislature, and
at least initially.
At least initially, and I think that's civil discussions when you do have areas of disagreement. There could be some real areas of disagreement. There's some things in there that should have everybody unhappy. And there are some things in there that should have everybody happy. That's part of the job of a State of the State or a State of the Union.
Chris, and talking to some Democrats yesterday, their consensus seemed to be that it was a well-thought-out plan, but it was still smoke and mirrors.
Well, yeah, I don't know so much about smoke and mirrors. I think what really impressed me about the governor's speech is that the review of the budget and the putting together the budget that they did, to me, demonstrated just a whole ton of work that they put into it. Instead of taking the easy way out, let's go back, let's do 10% here or cut X percent there. I think they went in, what they said they did, which is went into each budget item and made evaluations. Well, we're going to keep this, we're going to decrease this, we're going to cut that. And so I think they tried really hard to present a good budget. The fallacy with their approach was stated by the governor in the beginning of his speech, is that, well, the way to build a budget is to you look at how much money you have and then see what you can pay for, and that's kind of perhaps how you do a family budget. But when you're doing a government budget, when the government has certain responsibilities, I think the approach you have to take is you look at, well, what do we need to pay for to make this a livable place and to accomplish our responsibilities, and then see what it's going to cost and see how you're going to cover that cost. So I disagree with his approach, but I think that he worked really hard at it, and I was impressed with that part of it.
Okay, you are the financial expert, sir. How do you respond to that?
I would respectfully disagree. I think living within your means is very, very important, not only for us individually, but for the government. I don't have any angst about borrowing, but you don't. You borrow based on building infrastructure, building process processes, and you know that that's not going to happen overnight. So I'm okay with that, but I will tell you, the cuts that we're proposing, or that the governor proposed, or are being proposed, they're not anything that's going to take away anything from what I saw. That I didn't feel any more threatened about my house being broken into or burning to the ground, or my children being educated. I didn't see any of those types of game changers that would make me feel like, we went too far on these cuts. I thought they were very much.
I disagree. I think there was. Let me point out one game changer, and I think that's the 17%, which I think in percentage-wise is going to be 18. Okay, on the higher education. Now that's a game changer. If you ultimately destroy your system of higher education, I don't know if it's going to do it, but based on the cuts they've had before and these proposed cuts under Sandoval's budget, if you destroy your university system, then your best and brightest are going to go to school elsewhere. You're not going to get the research projects in and the money that brings in, and ultimately you're going to lose the game of economic development. And that's my worry, is that well, what do we need to do for the higher education system? Not let's cut it another 18% on top of what we did before.
And all I would say, Chris, is this. He also lifted the restriction on letting the regents set tuition. And at the end of the day, I've been involved with many organizations that do training, education, and the university system is highly, highly subsidized. The students just pay just such a minuscule fraction of what the actual cost is. And I'm just a proponent of just saying, what, let the pain be where the pain belongs. That there's a significant value there in that education. Significant. Well, let's charge for value, and as the governor said, well, we're going to have a reserve set aside for people that need that financial assistance to be able to still take advantage of it. At the end of the day, the system should pay for itself. If we're lessening the subsidy, the people that are taking advantage of it should be able to step up into that gap.
The conversation about exactly what Nevada is responsible for doing has been started with Kenny Gwynn, and it's been heating up. And I think that this is the session in which we're going to have to confront exactly what is absolutely necessary for us to do. That if we don't do it as a state, will there be a system in place to do things that are necessary? I think Medicaid is one of those. The Medicaid program is a joint federal-state program, but it provides the last formal coverage for people who are uninsured, who have disabilities, who have high use of medical care services. Below that, there's nothing more than charity care and some nonprofits and that sort of thing that are stretched already. The cuts in Medicaid are pretty draconian for a program that on every measure ranks at or near the bottom among the states.
Okay, let's take a break and we'll pick up on that when we come back. We'll be right back on Nevada Newsmakers after this timeout.
To contact Nevada Newsmakers, call 775-857-2244 or go to NevadaNewsmakers.com. And now, back to Nevada Newsmakers with Sam Shad.
And back on Nevada Newsmakers, we have an all-pundit show discussing the governor's state of the state and, of course, his appearance on the program yesterday. We're talking with Mike Bosma, Larry Mathias, and Chris Wicker. One of the things that came up in Governor Sandoval's speech was that he still feels that portions of the health care law are unconstitutional. We'll continue to fight it. But we must prepare for the expansion of Medicare, costs of $574 million to the state between 2014 and 2019. It's just an astonishing number.
It's an astonishing number, and it shows the frailty of the legislative process. Congress couldn't come up with an answer on what to do with people who couldn't afford to buy insurance. And to some degree, they were going to subsidize some in these private exchanges, but the answer was, they decided not to have a public option. They simply expanded the Medicaid program to cover most people up to 133% of the federal poverty level who were uninsured. The problem with that in Nevada is we currently cover people at 32% of the federal poverty level. And that's a lot of people that are now going to be on Medicaid if this program goes through. And I think probably this part of the program probably will go through because nobody has a better answer. But the feds are going to have to come up with a lot of money to pay for it. Nevada can't pay for its current obligations under Medicare or Medicaid. Our more or more accurately, Nevada hasn't properly paid for its current commitment under Medicaid. And that's why we're at the bottom of so many of these lists. We're behind Guam on what we pay per capita for Medicaid. It's not, but people get sick. We have such tight eligibility standards that for the most part, most of the money in Medicaid goes for people with disabilities, for seniors in nursing homes, for the severely mentally ill. Well, those people need care. If the state doesn't cover it, they're still going to need care. They're going to be using emergency departments, they're going to be on the streets, they're going to be in homes and getting infections, going to hospitals, and they're not going to be paid for it. And that means that there's going to be less available or at a higher price for everybody else. So there's no ducking responsibility that the state has assumed, every state has assumed to be the bottom, the safety net for just some patients. This is not for everybody who doesn't want to buy insurance. This is for people who really are sick.
Well, and also you look at the reimbursement levels now. They keep lowering to doctors. Why do doctors want to be doctors?
You know, that's almost one of those very difficult problems without a good answer to it, and it points out, I think I would echo somewhat what Larry said, the frailty of the healthcare delivery system. When I hear certain element of the political arena say that we have the best healthcare system in the world, we do. You know, for me we do, and for a lot of people that have good care, we do have the best medical care system. But if you look at the country as a whole, we're way down amongst the developed world as far as the quality of our medical care system, and I think finally you're seeing Nevada catch up to its responsibilities under the prodding by the federal government. Unfortunately, it had to be prodded by the federal government. But with doctors, you know, doctors attain a high level of education. They have one of the most difficult jobs in the world. Every day they're faced with judgment calls that affect people's life, limb, and overall health. And we want the best people in those positions. And at the rate of reimbursement that just keeps getting cut, it leads to the problem you're talking about. But what is the answer? Is the answer to say, okay, we're going to have a population that simply doesn't get health care, or if at best it gets health care in the emergency room? That's not a good answer, and that's the problem with why it took so long to get a comprehensive health care reform bill, is that a lot of the answers to it are pretty crappy, and doctors shouldn't be cut because of what they do and the education they have. But what's the other answer to it?
Well, part of the problem is going to be that the doctors who can't afford then to see Medicaid patients at 15% off of the 2002 Medicare fee schedule, which is what they've been paid now for the last 7 years, that they're going to drop seeing Medicaid patients. Well, it's access for those patients.
But there is a duality in most countries in welfare type care or in indigent care versus pay for service. And right now it's pretty much the same in Nevada, and I'd say in the United States. That way I get the same care if I'm a paying customer or if I'm not a paying customer. And I would say is the difference, you want to make sure that people are still handled by professionals, but I'll tell you, there's in most other countries, the way they've tackled this is they have the ability to go, you wait in line to go get your welfare care, and that's part of the drill. That if I'm going to have to make an appointment, go back in a couple weeks and to see the doctor, and that's kind of part of my entitlement as a citizen of this country, versus I can walk into any hospital I want to receive care immediately. And those are, from a service, just a business perspective, those are two different service models. Mm-hmm. And so I think we ought to, right now, I believe, just got our insurance quotes back, insane, and it's because there's more people taking care of taking advantage of the emergent care that's very expensive, and then lopping that on the few people that are paying. And ultimately, it's a tax structure, de facto tax structure.
Which is why, hang on a second, guys.
Why the state can't
we have to make some money here, otherwise we will be on welfare. We'll be right back on Nevada NewsMakers after this time.
The Tamarack Junction is South Reno's headquarters for food, fun, friends, hot slots, and video poker. Join the best slot club in town, the Conductors Club at the Tamarack Junction, where you can earn free play and comp dollars on over 450 of the latest state-of-the-art slots and video poker machines. Play your favorite games and win cash, comps, free play, and other great prizes. The Tamarack Junction, where locals meet in South Reno, just north of the Summit on South Virginia.
This is Nevada Newsmakers.
And back on Nevada Newsmakers, we continue our conversation with Mike Bosma, Larry Mathias, and Chris Wicker on our All Pundit show here today. Interesting comment from Governor Sandoval in his speech. End social promotion. If kids can't read by the end of 3rd grade, they stay in 3rd grade. For how long?
Well, you know, I want to back up just a little bit and say that I was disappointed that Governor Sandoval seemed to blame teachers for a whole lot of lack of progress in the education system.
Well, he blamed the system.
More than they.
He blamed the system.
I think teachers were singled out, but be that as it may, I think he's right that social promotion serves no good end. And you know, I think what you'd end up having to do, you can't have a I forget what the age is in 3rd grade, but you can't have a 12-year-old in a third year class just because the 12-year-old has been there time after time. There's going to have to be a diversion program if we're going to do that. If we're going to say no social promotion, we're going to have some kind of diversion program, and that wasn't addressed.
But doesn't that make sense, though?
Yeah, it does make sense.
Right?
You know, and I would absolutely agree. And one with Heath Morrison's comments at the Reno 2020 forum, you know, I believe they're trying to tweak the systems. Governor Sandoval, you know, presented some tweaks, some good add-ons to the system. I believe when we fix our graduation rates at a high school, that system that's invented is going to look nothing like what our current system is. So I think they just need to get their mind around, you know, Chris, I think you had a great point. You know what? A diversion program, these are not mainstream. We still want to make sure they get educated, but maybe that's the, you know, K through 12 in one room. You know, and I don't know, I'm not an educator by training.
But you know what? I have to say, this cuts through to the heart of the matter, which is that it is insanity that we have kids who can't read coming out of 3rd grade.
Right.
That's insanity.
Yeah, and it's worse that we have them coming out of high school and not able to read. I think that what this discussion is what is in miniature is what's going to be happening over the next 4 months. The 4 big budgets are where all of the sensitivity is. There are cuts there, and there are
K-12,
higher ed, Medicaid, and mental health.
And health and human services.
Yeah, right. Now, and where there are no good alternatives, but we're going to have to settle on some options that mix and match and do as little harm to people who have no option.
Well, the hard part is we've identified what helps kids succeed: a good family life and excellent teachers. But you know, how do you achieve that?
All right, let me change topics here. We've got about a minute and a half left here. You know, the governor lays out his speech, and as we all know, that is the starting point in the discussion. The Democrats control both houses. Do you see a similarity to the previous legislative session where the Assembly and the Senate just take over and rewrite the budget themselves? Or do you see, how do you see this playing out? Because I don't think Senator Horsford is in any way ready to not try and raise revenues.
I think he's right about that. I think it'll be quite a different process because I see Governor Sandoval as a very good person who wants to achieve good things. Unfortunately, he's painted himself in this corner.
But you're not saying that Governor Givens was a bad person or wanted to achieve evil things. I don't think that's fair.
No, okay, I didn't mean to imply that. But what I am saying is that Governor Sandoval will work harder with the other side. He's backed himself into a corner with his no new taxes pledge, but I think there will still be a dialogue. In the end, I think there will be revenue increases somewhere, and they're probably going to have to pass it over his veto.
Well, I'll tell you, one of the primary tenets of the Reno 2020 project is, you know, let's fix our tax base so now we've got a temporary problem for this biennium rather than a permanent problem. And I think that is going to take a lot of attention off of any temporary tax increases now, knowing we've fixed our tax base down the road. I think if he can get there, he'll be in good shape. good shape.
Right now, there's no two-thirds to do anything with the budget, with revenues, or with adopting reapportionment, redistricting. So it's going to be negotiations that's going to be very different from the last session, and it's going to be very challenging to do the horse trading necessary to get to two-thirds in each house. I don't see what the end game is at this point. No one does. Everybody has their own imagination about it. It's going to be very difficult. It's going to be very challenging. I think having new people in key positions of leadership is both a strength. They're not bound by their own experience in the past. It also has a weakness. They're not experienced in the past. And so that's where we're going to sit.
Thank you all very much. Very thoughtful discussion. I appreciate it. We'll be right back on Nevada Newsmakers after this timeout. As always, you can watch Nevada Newsmakers 24 hours a day at NevadaNewsmakers.com. You can also download the show free of charge from iTunes. On the next program, the hot topic, bankruptcy. We'll have all the details. We'll see you on the next broadcast.